This video depicts on the collaboration and teamwork between various healthcare professionals in dealing with a patient having or who is having a Fabry disease to deliver a safe and quality care. Before we start, let me give you a simple background about the disease. Fabry disease runs in families. It can have lots of different symptoms, including pain in the hands and feet and specific kind of rash. It usually starts in childhood and is much more common in men than women. It can take a long time to get diagnosed with Fabry disease. That's because the symptoms are common and can affect so many different parts of the body. Many people who have Fabry disease don't get diagnosed until years after they first have symptoms. They've often seen several different doctors and various symptoms and sometimes get the wrong diagnosis. If your family history suggests you could be at risk for Fabry disease, you may want to ask your doctor about getting genetic testing. So the scenario started with the mother dialing 911 and the emergency rescue unit responded to the site within minutes, and patient was then rushed to the hospital. And upon quick assessment by the medical health worker, patient was shivering, irregular spontaneous breathing, clenching fists. Red spots were noticed on the palms of the hands and soles of the feet, and the patient was with anhidrosis. Patient is experiencing chills, spontaneous irregular breathing, rashes in the palms and feet, anhidrosis, mental stupor. Temperature is 38.9 degrees Celsius, PR is 50 BPM, RR is 25 CPM, BP is 130/90, and O2 sat is 93%. Okay, nurse insert IV, gave Hartmann solution 30 drops per minute, and order urinalysis and CBC. Also give antipyretics and antibiotics, and admit this patient to the ward. Okay, doc, noted. So, mother, I am going to take a medical history of the patient, okay? So, how is the behavior of the patient for the past 6 months? Not very good. Just last week, October 10, we had an appointment at the OPD because she experienced stomachache, was vomiting, and also had a fever. And also she had those rashes in her hands. She said that she felt a stinging and burning sensation with those rashes. Actually, we've been to different hospitals and we've consulted different doctors since she was younger actually. And also they had different diagnoses. We don't know what to do anymore. And this is the first time that has happened. This is the first time that something like this happened to her. And if you can recall, at what age did she started getting sick? Yeah, I think she was about 12 years old at that time. I see. You've mentioned that last October 10, the patient had a doctor's appointment at the OPD, right? So what were the given medications? Yeah, we gave her paracetamol and sulfurexime. And was she able to completely take those medicines? Yes, nurse. Okay. So does she have any allergies to food or medications? No, none at all. Alright, that will be all for now. I'll get back to you when the doctor comes. Okay, thank you very much. How's patient Santos doing? Not good. Her vital signs were not improving that much. Temperature is 38 degrees Celsius, PR is 50 BPM, RR is still 30, and her BP is 130/90. According to the patient's medical history, she had an appointment at our OPD department last October 10 with a chief complaint of nausea and vomiting, abdominal pain, rashes on palms of the hands and soles of the feet. According to the mother, the patient who has visited different hospitals since childhood. Oh, and laboratory results came out a while ago, Dr. Miranda. Here it is. Let's see. Well, her urinalysis shows abnormal results of high BUN, creatinine, and proteinuria. Okay, we have to check her kidney and please order for kidney biopsy for patient Santos. Okay, copy that, Dr. Miranda. Okay, thank you. Okay, we're now going to start with taking the kidney biopsy for Miss Santos. Okay, so okay, move it up for me a little bit. And that's it. Okay. Okay, here's the specimen. Alright, thank you, nurse. Please take care of that. Okay, and we're done. Hi, this is the specimen for Miss Santos. Yeah, the one with the kidney biopsy. Okay, here it is. Oh my. Confirmed. Zebra bodies. Dr. Miranda, here are the results, the lab results for the kidney biopsy of patient Santos. Here. Okay, let me see. Zebra bodies, huh. That means she has Fabry disease. That's why she had those different diagnoses in the past. Okay, start ERT and refer her to the nephrology department. Okay, thank you, nurse. Hello, is this the nephrology department? Yes, I'd like to refer a patient. She's confirmed with having Fabry disease. Yeah, we did a biopsy with her. She's in ward 123. Okay. Alright, thank you. So, since the patient was now referred to the nephrology department and is now receiving an ERT treatment, it also led her to having a good prognosis. And that's all for my case scenario, and enjoy learning. Bye!
My darling, I love you, I love you, I love you, I love you.